just from the feeling of discomfort, I knew what I had was angular cheilitis because I wear retainers every single night to make my teeth look nice and beautiful. And these, I guess, were causing me to have some discomfort and drooling, and we'll talk more about that. So angular cheilitis, as the name suggests, occurs in the angles or the corners of your mouth, and you can get fissures or cracks. It's also known as angular stomatitis or perlé. So in my case, I believe the cause of my angular cheilitis this morning was due to my retainers that I use every single night to keep my mouth and teeth straight. And I also use these to prevent grinding of my teeth because I have something called TMJ. Usually I don't have any problems, but this morning I do recall waking up with my mouth a little bit open and I could feel like there was a little drool. Yes, that's disgusting, coming out of the corner of my mouth, and I believe it was because I was a little congested this morning, which was causing me to breathe at night with my mouth open, and then obviously I was leaning to the side on my pillow and some drool was dripping out. So what happens is the pH of your skin is higher than the pH of your saliva. Your saliva is actually pretty acidic. So if saliva drips out to the corners of your mouth, it actually causes breakdown of your skin barrier. And over time, this can lead to something called angular cheilitis, which is kind of like a dermatitis and an inflammation. A few other causes can be from dentures, but that's typically more common in elderly people. And then another very common cause that I see a lot amongst my friends is if they're using lip balms or even lip plumpers that contain fragrance in them. So the lip plumpers actually obviously make your lips look nice and beautiful and plump. But what happens is because they're plumper and swollen, it can cause the saliva to drip out to the corners of your mouth and then irritate your skin and cause a breakdown of your skin. If you have atopic dermatitis, it is possible that you notice that you have angular cheilitis more often because, as I mentioned earlier, angular cheilitis is a type of dermatitis of the mouth. Also, if you have recently used antibiotics or if you use inhaled steroids because you have asthma, then you may notice that you're also getting this drooling and pooling of saliva in the corners of your mouth. In terms of, I said earlier that this can also be known as perlé, and it's called perlé because there's a yeast called Candida that can occur in the mouth, and usually it's a white kind of like paste on the tongue. So you'll see, I don't have it, but if you've been taking oral steroids lately, you may have gotten it in your mouth. It's actually pretty common. And sometimes it can cause this yeast to pool out into the corners of your mouth and also cause this irritation. So that's just a side note. If you're someone that chews gum, sucks on lollipops or mint that have cinnamon flavor or even minty flavor, obviously you're creating more saliva in your mouth, and it again can cause this pooling of saliva and break down that skin barrier. So this is just something to keep in mind. If you're getting angular cheilitis, I recommend you stop chewing gum, stop mint, stop sucking on lollipops, because I do think you'll see an improvement. Now, this is also a very common side effect if you're taking Accutane or isotretinoin for acne. Also, if you're using acne washes like benzoyl peroxide or salicylic acid wash on your face during the day or in the morning or at night, sometimes they're more irritating and can irritate the corners of your mouth and cause angular cheilitis. So I always recommend that if you have acne and you're using an acne wash, then to actually put a layer of Vaseline around your lips, and don't forget to get those corners, and then wash your face with that acne wash. So it kind of acts as a barrier and it won't cause a breakdown of your skin. I do believe that there's a strong correlation between stress and angular cheilitis, because if I think back personally to the times when I've developed this in the past, it's been during times of stress and when I wasn't sleeping well. So if you can manage your stress better, I do think you'll see an improvement in this condition. I also advise avoiding things that are going to be more irritating, like spicy foods, acidic foods like orange juice or acidic fruit. Because remember, your skin barrier is impaired, so you don't want to cause more irritation, more discomfort, or even any burning sensation to yourself and your mouth. In terms of avoiding lip balms, I do recommend, as I said, avoiding lip balms that have propolis in it or even lanolin in it if you find that you're irritated by this. Also, for the time being, I would avoid chewing gum and mints because you want to avoid causing any more drooling or pooling of saliva. Instead, as alternatives, I recommend using something like Vaseline. This is 100% petrolatum, so it has no irritants in it, it has only one ingredient, and it's very safe. I have been applying this frequently throughout the day. You can never apply too much of it. I also recommend using Vani Ply or CeraVe Healing Ointment. Now, as for me, I know that it's probably because either I'm also stressed and I think last night I didn't sleep so well and because of my retainers. So I probably will take 2 nights off or so from wearing my retainers until this heals because I don't want to cause any further breakdown. Now, in terms of treating it, as I mentioned, use Vaseline or something like petrolatum because that will help the transepidermal water loss and heal the skin. Also, I recommend if you don't think it's getting better with petrolatum, then you may need to actually incorporate something like a steroid ointment. And I know I said that inhaled steroids can actually cause this, but if you use a very mild steroid for a very short period of time, I do think you can see an improvement. And if you're someone that has perlay, which is the fungus, you may need to incorporate an antifungal into your routine. So I hope this was helpful. I hope I clarified what causes these cracks and fissures in the corners of your mouth. And if you have any questions, leave them in the comments below. I would be happy to answer them and help you. And I will see you soon in the next video. And don't forget to subscribe.